Hi, my name is Zane Davies, and I'm certified athletic trainer at KVH. I'm also the head athletic trainer at Ellensburg High School. And we at KVH have identified a need in our community to provide up-to-date, accurate concussion education, and um, specifically for our secondary school athletes, our middle school athletes, their parents, their coaches, and as well as administrators. From my experience living here and working here and recreating here, of course, and talking to the community, it seems to me that this community is engaged and pretty well informed and curious about concussions. Generally speaking, I'll get the comment more often than not when I say, "Oh, I'm an athletic trainer and I work at KVH." They say, "Oh, so you do concussions?" Well, okay, that to me indicates a little bit more education, because what goes into concussions is actually pretty complicated. And I think that indicates, at least from the community, that we're ready to continue to learn about concussions. And so, of course, with this, we want to spread awareness and dispel myths regarding concussions, and all of this in observance of National Concussion Awareness Day on Friday, September 18th. Let's see if I can proceed to the next slide. Great. So what is a concussion? It's a complex pathophysiological process affecting the brain induced by biomechanical forces. I find that definition's not particularly user-friendly. If I could use a more user-friendly but probably oversimplified definition, that would be traumatic brain injury caused by direct or indirect forces. So a direct force would be, your head hitting the ground. An indirect force would be someone, uh, let's say a football player, hitting you in the chest, but the whiplash action of your head, similar to the one indicated in the lower left-hand side of the screen with the skeleton, that would be sort of an indirect injury mechanism. And I think that picture does a good job of illustrating what the injury is. Uh, to be a little bit more specific, if you look at the red area at the end of the arrow, that is more specific to where the injury is happening. And I guess if you could zoom into that, you would see the neurons and what's happening on at the I get almost microscopic level. You'll see something like the picture on the right, and that's where we get our symptoms. That's the chemical changes due to the injury that's happening in the cell. In the research, they call it the neurometabolic cascade of a minor traumatic brain injury, which is another name for a concussion. And so this is sort of the overview of what a concussion is for those who may be new to the term, and sort of how they happen. I wouldn't say that knowing the neurochemical cascade is the most important thing regarding concussion. I think perhaps the most important piece of concussion education that's came out in 2009, and that's the Zachary Lystedt Law. Zachary and I are about the same age. He was playing football. I think it was like 8th grade football in 2005 or 2006. He had 2 concussions occur in the same day in the same game, and had to be rushed to the hospital. He had what's called secondary impact syndrome, where there's swelling in the brain, and you need emergency surgery to sort of relieve that pressure, because if you don't, it could be fatal. And so to this day, Zachary actually is still dealing with some of the repercussions of that injury, but he's also championed policy changes and safety in sport since his injury. And so he's been a force for change. So the Zachary Lystedt Law is the toughest return to play law in the nation when it was signed in May 2009 by then Governor of Washington Christine Gregoire. The Zachary Lystedt Law prohibits young athletes who are suspected of sustaining a concussion from returning to the game without the approval of a licensed healthcare provider. Now, I highlighted licensed healthcare provider because not all providers are qualified to clear an athlete. Those providers are listed in the law are here on this slide. Pictured is an athletic trainer. The approved providers are medical doctors, doctors of osteopathy, advanced registered nurse practitioners, physician assistants, and of course, athletic trainers. The WIAA, or the governing body that governs our high school sports, does a good job of educating officials and administrators and coaches on recognizing the signs of concussions and helping to push forward the best practices surrounding concussion. So they've done a good job of collaborating with the Seattle Concussion Project, which is a partnership of Seattle Children's Hospital, as well as Harborview Medical Center and the University of Washington, to come up with the best practices, many of which are implemented into the WIAA policies and procedures. So from a procedural standpoint, WIAA has done a fantastic job with concussions. So, it's one thing to say, okay, now we know what causes concussion. What are some of the laws surrounding taking a player out or keeping them in? When we go down to the symptom level, and this is where I guess my time is spent a lot, and that's dealing with the symptoms and helping our student athletes deal with their symptoms and be okay with reporting them and explaining what's going on. So it's not just a headache, it's a variety of symptoms: cognitive, physical, emotional. It could affect your sleep, and it's becomes tricky to diagnose because some of these symptoms you could just experience on a day-to-day basis without a concussion. If we're talking drowsiness, trouble falling asleep, sleeping more than usual, sleeping less than usual, this just sounds like me at 17 years old in the beginning of the class day, or like right after lunch. Like, I'm groggy, I'm kind of irritable. I'm a teenager. It's kind of a hard group to diagnose because of these things. So that's why not everybody is allowed to do it. You have to have specialized training, like all of those providers listed before have, in order to dispel what's a concussion and what is just, being a teenager, just being a human being that has their ups and downs. So if you suspect a concussion, what should you do? Don't hide it, report it. That's perhaps the biggest thing. And that, once you report it and once you, reach out like, hey, I think something's wrong, you can be removed from play, you can seek medical attention, and you can do the other steps. But first you have to feel that it's okay to say, I don't feel right. And one way that we as a group and as a community can help increase reporting habits among our secondary school athletes is don't diminish the injury by calling it anything but what it is. It's a concussion. It's a traumatic brain injury. It's not just getting your bell rung. So once we sort of remove the stigma, and this will happen over time, and as we become more educated as a community about concussions and their side effects and the ripples that they have in a person's life, once we start calling it what it is, I think that reporting will become easier, and we can all rest easy in the process. Once you seek medical attention, it's important to report your concussion history. We found that people who have had multiple concussions become a little bit more sensitive to it, and their concussions become more complicated. So it's important to be forward and open about your personal concussion history, and that does play a role in helping you get through this next injury, and obviously allow adequate time for recovery. So we've talked about suspecting, what it looks like to suspect concussion and what to do. But from a healthcare standpoint, how do we evaluate concussion? Well, the first thing we do is we look for red flags. These are things that warrant a trip to the emergency department or to urgent care, just to rule out that nothing bigger is going on outside of concussion. So a few of these, one pupil larger than the other, that could indicate a brain bleed, headache that gets significantly worse, doesn't go away, weakness, numbness, decreased coordination, or slurred speech. repeated vomiting, loss of consciousness, convulsions or seizures, or difficulty recognizing people or places, or increase in confusion. And I think as a theme for these, if things are getting worse and worse, it's time to go see your doctor or the emergency department. There are a few myths embedded in this where in the past, it was thought that if somebody vomits after a concussion, that they should go to the emergency room. Well, we found that vomiting actually accompanies a concussion in a lot of people. It's just one of the side effects. It doesn't require a trip to the emergency department, but if you're continuing to vomit and it's not getting better, like it's a good idea to go in, make sure nothing bigger is going on, and maybe they can help you with medication or whatever. Loss of consciousness, that's one that generally warrants a trip to the emergency room. It maybe doesn't require an ambulance ride, but it's something that should probably, you should see your doctor. And it wasn't too long ago that loss of consciousness was like a grade of concussion, that, you know, concussion didn't happen unless you lost consciousness. So we've come a long way, and hopefully some of those myths are starting to go by the wayside. This is a tool that we use as athletic trainers, and I think that doctors and physician assistants all use this same tool. It's the Sports Concussion Assessment Tool 5th edition. It covers a broad range of aspects of concussion and helps give us an idea and the ability to use our clinical judgment and a number that we can derive from this test that says, hey, you're probably concussed. It's best used if we also have baseline testing on hand, and I highly encourage every student athlete in the county to go ahead and seek out baseline testing, either with me or with a qualified healthcare provider, to help us when we have to, you know, administer this test after an injury, to help give us a better idea of what's going on. The VOMS test is one that is great used as a supplement to the SCAT-5, where this test is great at provoking symptoms in people who have had a concussion or have a concussion currently, more accurately. For someone like me, I get car sick and I don't like roller coasters and things, so this is a hard test for me in the first place, and I can only imagine how hard it would be if I have some of these concussion symptoms. So this is one that helps us rule in a concussion, and is one that, again, is also more useful if we have a baseline number to go off of. And lastly, the last test that we use, or last tool that we use, is neurocognitive testing. This is something that there's been barriers to using it. Generally speaking, it's been cost. It's hard to, you know, the impact test is a pretty expensive test. So a lot of school districts and leagues have decided we're going to forego this, but this is a good tool for helping diagnose and treat concussion. It's particularly useful in the hands of a neuropsychologist, because they can go through the numbers that these tests sort of accumulate, and they can see where the brain isn't functioning optimally, and helps the individual who is, you know, who has a concussion, help them deal with some of the symptoms that are not just the headache and things like that. What if it's reaction time, and maybe it's vestibular, maybe it's eye tracking, or even emotional or attention things that have changed. And it's actually particularly useful as well for helping us measure the baseline of where our brain is on a normal day and how that compares to concussion. And these are well-researched tools. They have been used in generally bigger leagues and some of the pro leagues and high-level football. It's something that we should consider implementing into our care. And I think on the district level, it's not always used. And hopefully in the future, we can start to integrate these tools. And so home care, this is very applicable for parents, especially. This is what we do directly following a concussion, and kind of mixed into this slide are some of the myths that I was talking about. the first one, no need to keep the athlete in a dark room. That was a myth, that if you have a concussion, you need to be in a dark room and rest, all day. Well, they found that actually hurts your ability to recover, as you're going to recover slower if you do that. And the best thing to do actually is just go through your regular day and just take more breaks and try and control your symptoms. And the more you try to get back to normal and do the normal things that you do, that's been found to be the best rest. It's not exactly sleeping all day. It's just doing the things you normally do in a restful way. Good hydration and diet are always helpful. Avoid alcohol use, obviously. Limit your screen time. And I think that's particularly challenging right now since school isn't necessarily in person. So I guess with that one, some of the extra screen time that's outside of school and outside of normal activity, start to put some limits on that, especially right after concussion. If you feel that medication is necessary or warranted for your child, stick to Tylenol. It's just better for, it's better not to mask all the symptoms of concussion, because those are the things that sort of drive our treatment, right? We don't want to falsely think that this person has no symptoms, when if they didn't take a medication, that they would be middle of the road and not quite there yet. But Tylenol specifically has a lower chance of creating extra bleeding in the body and things like that. So Tylenol is the best medication to stick to. And I guess a reminder that concussions are not structural. So there's no imaging that will diagnose concussion. So it's something that is only necessary to go get the MRI and the CT scan if you have some of these red flags. Otherwise, extra medical imaging is actually not necessary. This slide just illustrates sort of the team that we have at KVH to help you manage your child's concussion. And at the center of that is you and your child. This is a group of professionals that have their own specific specialty that collaborate with each other with the goal of getting this patient better. And each person serves a particular role and is something that goes along with our community-based approach and our team-based approach to managing concussions. So return to learn, that's another important piece, that if we're thinking about the screen time and school that's remote, this is where our school nurse and our athletic trainer and our administration helps us out. Because if you think about it, if you hurt your knee in PE class, you probably wouldn't be expected to run the mile that next day at school. Maybe they can accommodate you in some way. Well, the same is true for a brain injury. You should receive accommodations from your school. And so contact your athletic trainer or your school nurse or, and your teachers and whoever to help get those accommodations. And this is a basic step-by-step process, the goals of which build on each other. And if you can go, let's say 5 to 15 minutes of school or of reading at a time, then you can go to the next step, which is the actual school activities, where you can work on homework and read and do activities outside of class. Perhaps you're not actually showing up to class, but you're starting to work on the things that your class is working on. Followed by gradual introduction to schoolwork. So you're showing up to your Zoom class, or you're going to physically to class, but maybe you need breaks and things. But the goal is that you're increasing the academic activities. And then finally, you return to school full time without the breaks, without the accommodations, and then you're tolerating it. We need to go through all of these steps before we return to the return to play protocol. Student comes before athlete. We need to be able to do the things we need to do at home. Then we need to be able to handle the classroom before we can even think about returning to play. I think the return to play protocol is something that maybe we're all more familiar with than return to learn. This is something that is not new to the WIAA, not new to Washington. It's a step-by-step process that that we use as athletic trainers and as healthcare providers to safely return someone to sport. So it starts with symptom-limited physical activity. So this is basically your day-to-day without sports. Stage 2 is we'll get on a stationary bike and we'll do some cardio for 5 to 15 minutes. And if we don't have symptoms, we can move on to the next step, which, maybe is kicking a soccer ball, doing some cone drill, running, those sort of things that have very low risk of hitting your head. And then we would move on to, and that's without symptoms, we would move on to non-contact drills with our team. You can go through the warm-up, you can do most of those things, but you're not contacting people. You're going to wear a red jersey or something so that people know that you are not to be hit. And if you can go through that practice without any symptoms, you're feeling great, we will medically clear the individual, but that doesn't mean you're cleared to play in games yet. You're cleared to participate in a full contact practice. Once you get through that contact practice and we deem that you are ready to return to sport and confident in your ability to return to sport, and then we can clear you back to participate in games again. At any point in this progression, if you receive or you feel symptoms after that day's activity, then all we do is we just go back one step and we keep trying to move on to the next step without symptoms. You don't have to start all the way over to step 1 if you were at stage 4. But it's important to be honest with us as the healthcare team in this process. So some take-home messages for today. Don't hide a concussion. I hope that as adults we can begin to break down the barriers that exist that keep people from reporting, including sort of taking away the stigma of concussion and reporting concussion. Remove the athlete from play when you identify that something may be wrong. And as an athlete, speak up for yourself and remove yourself from play just to make sure you're okay. Seek medical treatment. That goes along with the other two. And make sure you advocate to your league or to your high school or whomever to help get the medical professionals to your student athletes' games and to be a part of your team. Follow the return to play protocol, be honest throughout the protocol, and stay up to date on current information. So concussions are manageable. We have an entire team in place here at KVH and in the Valley that we can handle all that encompasses concussion. We can handle here at home. And we've worked hard to make sure that we have made these tools accessible to the secondary school athletes and to any of the recreational athletes that we have here in the county. So thank you for tuning in and listening to this presentation. If you have any questions or you want any information from me, my email is right there, zdavies@kvhealthcare.org. And I'm happy to share that with you, and I'm happy to meet everyone at Ellensburg games, Cleveland games, Kittitas games, and out in the community. So thank you very much, and have a great day.